Constipation after 60 is common, but when your bowel pattern changes suddenly, or keeps changing in a way that feels unusual for you, it deserves attention. Maybe you used to be regular, and now you're only going a few times a week. Maybe the stool has become harder. Maybe you find yourself straining more. Maybe you go to the bathroom, but still feel like you did not fully empty. It is easy to dismiss this as just another part of getting older. But after 60, a new bowel pattern can be a body signal. Not always a dangerous one, not always an emergency, but a signal worth listening to. Because constipation is not only about how often you go, it can also mean hard stools, painful bowel movements, straining, feeling blocked, or feeling like the bowel movement was incomplete. That is why the most important question is not simply, "Did I go today?" The better question is this normal for me, or is this new? Many people believe constipation means you must have a bowel movement every single day, but that is not true for everyone. Some people naturally go less often and feel completely fine. Other people may go more often but still feel constipated because the stool is hard, difficult to pass, or incomplete. So the pattern matters, your normal matters, and a change from your normal matters even more. After 60, constipation can happen for ordinary reasons. Your meals may be smaller. You may drink less. You may move less because of joint pain, fatigue, travel, surgery, or illness. You may have started a new medication or supplement. Your daily routine may have changed. All of these can affect the bowel. But common does not mean meaningless. A new pattern is worth noticing because it may tell you something about diet, hydration, movement, medications, blood sugar problems, nerve function, pelvic floor coordination, or another digestive issue that needs review. One common factor is low fiber intake. Fiber helps stool hold water and adds bulk, which can make bowel movements easier for many people. If you're eating fewer vegetables, fruits, beans, oats, or whole grains than before, stools may become harder and slower to pass, but fiber is not a magic answer for every person. Increasing fiber too quickly can sometimes lead to bloating or discomfort. And some types of constipation are not mainly caused by low fiber at all, so fiber can be helpful, but it should not be treated as a cure-all, especially if the constipation is new, worsening, or comes with warning signs. Hydration is another important part of the picture. Stool needs fluid to stay softer. When you're not getting enough fluids, the colon may pull more water out of the stool, making it harder and drier. This can become more common after 60 for simple reasons. Some people feel thirst less strongly. Some avoid drinking in the evening because they do not want to wake up at night. Others take medications that may affect fluid balance. Drinking more water will not solve every case of constipation, but if your stool is dry and hard, and you know your fluid intake has been low, it is worth paying attention to hydration. Unless your doctor has told you to limit fluids, movement also plays a role. The bowel is part of a moving system. Gentle activity, such as walking, may support normal bowel movement for many people. When activity drops, the bowel may slow down too. This is why constipation can appear after a hospital stay, a long trip, a period of sitting more than usual, or a time when pain or fatigue keeps you less active. Movement is not a guaranteed fix, but a sudden drop in daily movement can be one possible reason the bowel pattern changes. Medications are one of the most important causes to consider after 60. Some pain medicines can slow the bowels. Certain antacids, iron supplements, calcium supplements, antidepressants, allergy medicines, bladder medicines, and some blood pressure medicines may contribute to constipation in some people. This does not mean those medicines are bad, and it does not mean you should stop them. Never stop or change a prescribed medicine on your own, but if constipation began after a new medication, a dose change, a new supplement, or more frequent pain medicine use, write it down. Then ask your doctor or pharmacist whether it could be contributing. Sometimes the most helpful first step is not another product from the store. Sometimes it is a medication review. Blood sugar and diabetes can also matter. Over time, diabetes may affect nerves that help control digestion. This can sometimes contribute to constipation or other digestive symptoms. Constipation does not mean you have diabetes, but if you already have diabetes, prediabetes, or blood sugar concerns, and your bowel pattern has changed, it is worth mentioning to your healthcare provider. There can also be an issue with the way the pelvic floor muscles coordinate during a bowel movement. Some people feel the urge to go, but still cannot pass stool easily. They may feel blocked. They may strain and strain, but still feel incomplete afterward. That kind of pattern is different from simply needing more fiber. It may involve how the muscles and nerves around the rectum and pelvic floor work together, and that may need proper evaluation rather than repeated self-treatment. Another overlooked factor is delaying the urge to go. Many people hold it in because they are busy, traveling, uncomfortable using public bathrooms, or trying to keep a schedule, but repeatedly ignoring the urge can allow stool to become harder and may disturb the body's natural rhythm. Over time, bowel movements may become less predictable. For some people, a regular bathroom routine, especially after meals, can support a steadier pattern. Now, one of the biggest misconceptions is that constipation after 60 is always normal. It is common, but it is not always something to brush aside. A new or worsening bowel habit deserves attention, especially if there is no clear explanation from a recent change in food, fluids, activity, travel, illness, or medication. Another misconception is the opposite. Assuming constipation always means something frightening, that is not true either. Many cases are connected to ordinary, manageable factors: diet, fluids, movement, medications, routine. But the reason we take a new pattern seriously is that sometimes constipation can be connected to an underlying condition that should be checked. The goal is not fear. The goal is knowing when to stop guessing. There are certain signs that should move constipation from watch and track to call the doctor. Blood in the stool or rectal bleeding should be discussed with a healthcare provider. Constant or severe abdominal pain should not be ignored. Vomiting, fever, inability to pass gas, or severe bloating can be more concerning and should be evaluated promptly. Unintentional weight loss matters. New fatigue, especially if there is concern for anemia, matters. A major change in bowel habits matters. New or persistent narrowing of the stool should be mentioned. Constipation that is new after 60, especially without a clear reason, is worth reviewing. And if you have a family history of colon or rectal cancer, your doctor should know that too. This is not to suggest that constipation automatically means something serious. It does not. A few days of constipation after travel is different from a new pattern that continues for weeks. Mild straining is different from bleeding, constant pain, vomiting, or inability to pass gas. The pattern matters. The symptoms around it matter. Your age and medical history matter. There are simple, safe steps that can help you understand what is happening without jumping to conclusions. Start by tracking the pattern. How often are you going? Is the stool hard or lumpy? Are you straining? Is there pain? Do you feel blocked? Do you feel fully emptied afterward? Then think about what changed around the time constipation began. Did you start a new medication? Did you take more pain medicine? Did you add iron or calcium? Did your activity level drop? Did your appetite change? Did you travel? Did you drink less fluid? Did your meals become smaller or lower in fiber? A simple record can make a doctor's visit much more useful. Next, look at daily habits. Drink fluids regularly. Unless your doctor has told you to limit fluids, add fiber gradually through foods you tolerate, such as vegetables, fruits, beans, oats, or whole grains. Move your body as safely as you can. Even gentle walking may support digestion for some older adults. Try not to ignore the urge to go, and consider a regular bathroom routine, especially after breakfast or another meal, when the bowel may naturally become more active. Also, review medications and supplements with a pharmacist or clinician, especially if the constipation is new. Be careful with over-the-counter laxatives and bowel products. Some may be helpful in the right situation, But repeated or long-term use should be discussed with a healthcare professional. Older adults can be more vulnerable to dehydration, medication interactions, and electrolyte problems. Be especially cautious with detox teas, colon cleanses, or products that promise to reset the bowel. Natural does not always mean safe, and over-the-counter does not always mean risk-free. The safest approach is not to chase quick fixes. The safest approach is to understand the pattern, support the basics, and get medical guidance when the change is new, persistent, worsening, or comes with warning signs. So when should you talk to a doctor? If constipation is new for you after 60 and you cannot clearly explain it, talk to a healthcare provider. If it persists, worsens, keeps coming back, or does not improve with reasonable self-care, get it checked. If it comes with blood in the stool, rectal bleeding, constant abdominal pain, vomiting, fever, inability to pass gas, unexplained weight loss, significant fatigue, or a major change in bowel habits, seek medical advice promptly. And if you are due for colorectal cancer screening, or you're not sure whether you are up to date, ask your doctor. Constipation is not always an easy topic to talk about. Many people feel embarrassed. They joke about it. They ignore it. Or they quietly take products for weeks without telling anyone. But bowel patterns are part of health. They can reflect hydration, nutrition, movement, medication effects, blood sugar concerns, nerve function, pelvic floor function, and sometimes more serious digestive issues. After 60, the goal is not to worry about every bathroom change. The goal is to know you're normal. Then notice when normal changes. A new bowel pattern deserves attention, not panic. Attention. Constipation may be temporary. It may be linked to food, fluids, travel, less movement, medications, supplements, diabetes-related nerve changes, or pelvic floor coordination, or it may be something your doctor needs to evaluate. The main lesson is simple. Do not assume constipation after 60 is always just aging, and do not assume the worst from one symptom. Look at the pattern. Look at what changed. Look at the warning signs. And when in doubt, ask a qualified healthcare provider. Because your body often speaks through patterns before it speaks through emergencies, and a new bowel pattern may be one of those signals worth hearing. If you want more calm, practical explanations about health after 60 and the body signals worth noticing, subscribe and keep learning with us.